Secretary Kennedy, the report lays out some changes for vaccine injuries and how those will be investigated. Can you expand more on how that process will look differently than it already does, since the government does investigate vaccine injuries currently?
Yeah, I mean, there has been no investigation of vaccine injuries in the past. The knee-jerk reflexive reaction to the by the agencies toward people who said that they had vaccine injuries, or to doctors who said my patient was injured, was denial that this isn't happening. And every medication has side effects, and they cause injuries that are rare. The people who are injured deserve the same kind of care and consideration that we give to anybody who's injured in this country. And, we have thousands of reports to VAERS, the Vaccine Adverse Event Reporting System, of people who say that they got a vaccine injury. One of the things we've learned in our investigation is that about 80% of the people who contact the Vaccine Adverse Event Reporting System, because they've made it so difficult register to report a vaccine injury, that they give up before reporting it. Doctors are discouraged from reporting it. They're not compensated. It takes them about 30 minutes on average to report an injury, and they're not compensated for it. And they also have disincentives from reporting it. We're changing the system. We're going to make sure that there's a system. Right now, the CDC's own study of their only surveillance system, their study of it in 2010 found that it collected fewer than 1% of vaccine injuries. It's collected over 99% of vaccine injuries go unreported. And CDC actually developed a machine counting system in 2010 that was collecting 90 or 95% of vaccine injuries, but they shelved it. And they kept this old system that everybody has recognized has been broken for 50 years. It's never worked. And because vaccines are the only medication or medical product that is exempt from pre-licensing safety testing, it's very important to have a post-licensing surveillance system where you're going to see the vaccine injuries. Under the current system, most of those vaccine injuries will remain invisible, and we will not be able to understand the risk profile of those products and do something about it. None of the people who reported injuries are ever followed up with. We're going to start following up and find out what kind of genetic vulnerabilities, what kind of other vulnerabilities they have. We are recasting the entire program so that vaccine injuries will be reported. They will be studied, and that individuals who suffer them will not be denied or marginalized or vilified or gaslighted. They will be welcome, and we will learn everything that we can about them so that we can improve the safety of these products.